All right, well, good morning, everyone, and welcome to our presentation today. A big thanks to our two guest speakers who are Kyla Walters-Clinton. First off, will open us up today with some situation recap on Medicaid redetermination in Rhode Island. She is the Director of Engagement.
Yeah,
just as a housekeeping note, if you could be sure to mute yourselves as you come in today, that would be great, just to help minimize disruptions for our presenters. And so after Kyla, we will pivot over to Shelley Souza, who's the Program Manager for the Statewide Assisters Network, which is with the Rhode Island Health Center Association. And she will inform a variety of us here today on how organizations can become accredited as certified application counselor agencies, and she'll give some background on what navigators and certified application counselors can do as part of this process. So with that, I think I will turn it over to you, Kyla, if you want to open things up this morning and give us some more info on Medicaid redetermination.
Hey, thanks, Blaze. Good morning, everyone. I'm very happy to be here. Again, my name is Kyla Walters-Clinton. I'm calling in today from Cranston at EOHHS. As we get to know each other real briefly, I love knowing who's in the room, so feel free to put in the chat where you're coming from today. And your name. I'd love to see that as we go through this. I'm going to share my screen really quickly if I have those permissions, and I'm going to walk you through the community update that was recently given. This is going to be a long deck, so I'm going to go pretty fast, but know that you'll be able to get this information and go through it at your leisure. So the first question I normally get is, what is Medicaid renewal or redetermination? And I want to give you a little bit of context. During the pandemic, Medicaid renewal was paused. So this is something that we traditionally would go through if you are a Medicaid member on an annual basis. But because we wanted to make sure that people retained their coverage during the pandemic, the federal government paused that process. And so starting April 1st, people are going to have to get back into the routine of redetermining their Medicaid every year. There are going to be certain groups that will go through what we call an auto or soft renewal, and those will be our customers that are on SSI or our children. They'll be renewed in 2024. And there's also going to be portions of the population that are auto renewed by the system doing a review of their case in advance and pulling from a lot of different sources to get that material and renewing them that way. One thing that we have to clarify is that the redeterminations are affecting Medicaid. They're not affecting other benefits. However, as things change, other benefits will change, so please stay tuned for those updates and those messages, but just know that this is focused on Medicaid renewals. What's going to happen is that we're going to go through this by groups. And so starting April 1st, a batch of people will get those notices and will be asked to come in and renew. And right now, we can't tell you exactly who those folks are going to be. We're trying to pinpoint that information, but and as it comes out, we'll be able to share it. What we're doing when we think about outreach is looking at our high density populations, as well as some of those populations where we don't have a lot of resources, to make sure that we can provide access and information so that people can renew their Medicaid benefits. This is a draft of the renewal notice sequence. Again, this is a draft, but what we think is going to happen is that people will start off by getting notice one that's going to talk to them about the renewal restart with some update information and really highlight the possibility of people trying to take advantage of this population and make sure that people are aware that they should be getting messages from their managed care organization or DHS office or Health Source RI, and only trust some of your trusted community partners when you're engaging in this process. The next notice will be on a purple piece of paper, and that is going to be recipients that are going to start the redetermination. The next notice will be on yellow, and that will be like to say, you know, we sent you a notice one already. We sent you the purple one to get ready to update your information. Yellow, we still haven't gotten it, so make sure that you send it. The next one, actually the yellows are also going to be the actual information that you need to be putting in. And then that orange is going to be, hey, we still haven't gotten that information yet. And then that notice 5 is going to be a packet where the state is like reviewing people that don't need to call, and they can wait for a white notice. Again, this is just a draft. We will be coming back to you again to talk about this as it gets confirmed and we have more information. We want to make sure that our community partners understand what the process is in advance so that you can help the people that you're working with. Our engagement with you is essential, so I really appreciate everyone being here, and I really appreciate the time. We want to make sure that we're talking with you guys, we're communicating with you guys so that you have the capacity to inform the members that you're working with, inform the community, and be that trusted baton that we work with, those partners, that we know that our members will be able to receive the information and not be scared and worried that they're just gonna fall out of their Medicaid insurance plans and they don't know what's gonna happen next. So that's why this is really, really an important tool, an important way to get your feedback and to continue to work with each other. Again, this is a summary of what we are trying to do here through this forum. We want to educate and empower community members to be those trusted messengers with this critical information, because we know that it needs to be timely and it needs to be linguistically appropriate so that the most at-risk people will not be left behind. If we do this in a meaningful way, we will make sure that our broad outreach engagements and our targeted outreach engagements will be fruitful. We'll amplify the message, and we'll make sure that we target those in populations with canvassing and community support, and we'll meet the needs of our Rhode Islanders. This is an overview of how the message is going to go. So we're starting with social media and press briefings that will be happening soon. Online videos. We did a webinar last night with Tina Penderson on her live podcast. And so we're just going to continue to do things like that. We have a community advocate forum that happens monthly, and I will send some more information out for that. There'll be messages on the call center, direct messages will go out, those provider notices that we just reviewed, and will be showing up at existing forums and commissions to have these conversations. Lastly, there are going to be targeted outreach plans where specific targeted populations will be reached. And that's when I work with partners like yourself to say, how is the best way to target? What are the best methods that you're used to using that we can adapt from COVID? And establish new partnerships so that we can develop new ways of reaching community members. These, these are the populations that we've targeted for outreach that we believe are most at risk of being left behind. We are also open to taking feedback of anything that is written that you want to put out. We're going to have a toolkit that comes out soon, so you'll have some basic guidance of what type of messages and how we're framing things, and you can adapt those to fit your communities. If you want us to review anything that you want to put out, please feel free. We're going to have an email address that I will send to you. You can send that material back to us, and we'll have our comms teams review them, but give us about 3 to 5 days to get that back to you. We're also working on a map that looks at the folks that are on Medicaid by zip code, and we look forward to sharing that with you as well, so that we can target our outreach by language and by demographics. We've also begun a speakers bureau, so if you want to be involved in that, you know that you are that community member that's out and about and that's talking to people all the time. We want your voice, we need your voice, and so if you want to be a part of the speakers bureau that's coming up, please, you'll be able to, I'll leave my email in the chat and you can send me a message and we'd love to work with you. Some of the places that we've already attended are the Long-Term Care Coordinating Council, the Health Source RI Advisory Board, the Opiate Settlement Advisory Committee, and the Managed Care Organizations. And so if there are any other partners that you feel where you want us to come speak, we will also come speak and share this message there. As you can see, we have listed the health equity zones as one of our major partners. And so again, that's why I'm happy to be here and answer your questions and provide you with some support. One of the things that I want to share is that we're trying to open up mini grants to help you do this work. So I look forward to having conversations about that, answering questions, and providing more guidance. So more to come on that. This is a slide that just gives you an opportunity to register for the community advocate forums, post questions, sign up to volunteer, provide us with any feedback. And so this is in that packet that you'll be able to get, and they are active links. Some of the key messages that you want to share, like what can people do right now? People can contact their managed care organizations, flip the back of their card, call that number on the back of their card and update their information. There is no reason to wait on this. You want to have people update their information. That's the best thing that they can do, so that when Medicaid starts churning out these notices, their notices will reach them. People have online access to do this as well. Go through the healthyroadri.gov link to be able to do it online. You can also call Health Source RI at the number that's listed, or you can go in person to a DHS office to get customer support. There's also an app that'll be coming out soon, and our media, like you'll see stuff on buses and in the community about this once the media package gets finalized, and that should be coming out soon. This is really important. This is a national effort. The government is changing the way that they're doing things. So we are really concerned that people will be getting taken advantage of. So this is the other thing that you want to make sure that you're communicating to our members, to make sure that, you know, if they get in their gut that feeling that someone's asking for Social Security information, bank account information, that is not what EOHHS, DHS, or any of our providers are going to be asking them. So they need to be, they can report it by calling the internal audit fraud complaint line. There's a form that will be linked here. You can call the fraud unit by the number that's here. And if you detect it, you know, if you're just concerned at all, please begin to report it, because times are hard and people do what they need to do to survive. And so we have to protect our people that we care about, people in our community from fraud and scams. So this is really important. These are the key engagement milestones. This is just a broad overview of where we are in terms of our outreach efforts and how we're thinking about moving the message out. So this is a really timely conversation to be having with the HES group, because you are part of our partners, part of our outreach attempt. And we're just so excited to be working with you all. This you'll be able to go over at your leisure. Last night we did a Facebook Live, and upcoming are those information packets that include multilingual flyers on Medicaid renewal. You also receive partner onboarding materials, including a one-on-one 101 deck, like, you know, the 101 facts you need to know about this process and frequently asked questions. and a fact sheet for the notice 1 and the future notices. I know that I talked a lot and I sent a lot of information and shared a lot of information with you. So I want to give time to answer any brief questions that you may have, but just also to take a pause and see what the temperature is in the room.
Thank you, Kyla. Does anyone from the group have any questions they want to highlight? Feel free, you can use the raise hand feature. I can call on you, you can put them in the chat and I can read them out if you're more comfortable that way, or if you just want to unmute yourselves and ask, feel free to take this time. And I know there was lots of information there, and as Kyla stated, we can share this out to the group that attended today for you to look through more in detail, and it will have in there, some links to other events as well that are coming up that you can learn some more information. If this is maybe one of your first steps in learning about this process, it's a lot to take in and it is complex. As Kyla said, national effort, every state is going through this and such. So I see one question in the chat here. Kyla, as far as the timeline between batches of groups that are going to be communicated with, any insight on that? And so, Stephanie, is that referring sort of back to the beginning there and those different phases of groups that we're going to be outreach to?
Yes, just how long the time period will be between the batches being released. Because if we're doing outreach, and providing some support services, it would be helpful for us to know and to be able to anticipate the waves, so to speak, coming in.
So those waves will be coming out monthly. That first wave comes out April 1st. And so the first time someone may get a notice about potential loss of Medicaid is at the end of May. There are some safeguards that are put in, and we will continue to talk to the group as we just shore up those details in terms of what's the next notice that comes out in that timeline, what's the safety, like how the holding pattern, where you get put off into like there are what's called Medicaid, like Medicaid has to prove certain amount of contacts with folks when they do their reporting for the federal government. So we'll have somebody from the Medicaid team be able to talk to you more about what that looks like and what those outreach attempts have to be in order for someone to really get that final close. So I'll be bringing that information back to you at an upcoming event. I believe we're going to, well, I won't talk about the upcoming events yet. We'll let that notice come out.
And Stephanie, I'm sure when we get the info on what those groups will be, as Kaya said, it will be monthly. We can share that information out to folks. And so,
great, thanks.
Of course, thank you for the question. Looking to our next question in the chat, just about the mini grants. Kyla, will those be for outreach efforts, or what kinds of things will those be able to cover?
We're exploring that now. And so any suggestions on or language that you want to provide, feel free. In this deck, you'll see a feedback loop. So feel free to provide that feedback, because we're working with partners to find out what the constraints are and what the language needs to be and what the needs are. So feel free to put that into that form and I will take it back. But we're exploring that now. We're hoping to provide mini grants for people to do this work after hours, to be able to sign people up additionally. We're trying to look at what that looks like now.
All right, thank you. And next question in the chat, just about the renewal application itself. Is that going to be a specific application? Will it be sort of the original application that people used to recertify in the past, or the regular application they used to apply generally? Do you have those details?
It feels like and I have to say, this is from my perspective as someone that doesn't work behind that desk. But as I hear these conversations, it seems like it's a combination of the two. It's a lot of information being pulled from a lot of different sources that have traditionally gone into that renewal application. So, but it's also being processed a little bit differently. So that's a great question, and we will make sure that we have someone that can speak to that a little bit more. And I think that there are courses that have been provided by our Medicaid team, I think in conjunction with either CCRI or RIC, where you can go through a renewal of what that recertification or redetermination process looks like. So I think that information, I think I saw you posted something about that too, Blaze, in your email. But we'll get that information to you. We'll provide you with opportunities to really digest this from the level of expertise where you sit. So stay tuned for more information and keep asking for it.
All right, thank you. And before I read some more questions in the chat, maybe we'll go to Patricia with her hand up.
Thank you, Blaze. A comment and I guess a question, and my apologies if I missed that. Congratulations on the plan. The outreach effort, it's outstanding. Just one thing in terms of the outreach effort, I didn't see anything about radio. And the only reason it's because, again, social media, it's great. Print, it's wonderful, but there's still that population who are Medicaid recipients who's getting it from a radio station that they probably listen to all day long. Maybe another way to reach out to them and really just give them a heads up. I worried when we sent to families so many flyers and things that they get in the mail. We all get the junk mail every day, and these families are no different. And so I'm afraid that they're just going to miss that opportunity. So no, thank you, and congrats on a great plan.
Thank you so much, Patricia. It's great to see you here. Thank you.
Same here.
And please know that is going to happen. We're working with our media team. We had some bumps in the road. We had gotten a lot of applications from partners that we had to just process through and start that operation again. And then we lost some folks on our team. So it's held us up a little bit, but please let us know about others. I've been on the radio, I had stations, and I know that community radio stations changed. So feel free to provide any of that information. You can throw it into the chat right now of the radio stations that are hot that our communities are listening
Fantastic.
to, because that definitely does change. So thank you for that.
I'll follow up with that. Thank you.
All right, I'm going to do a couple more questions from the chat, and then Teddy, I see you have your hand up, so we'll move over to you after these next couple questions. Next, I see, what is the fastest or most efficient way for clients and patients to update their addresses? Kyla, I would think if they don't want to wait on the phone and they're tech savvy, to go on Healthy Road and update there. And then if not, maybe calling their provider. What would you say for that?
I agree. I think that calling a provider is great. I think the next time that they're at their doctor's office, to update their information there. And it depends on who the person is. There's going to be an app that might be easier for folks depending on where they are. Jumping online is also a pretty easy process. And thanks to Blaze, we're trying to investigate that so that there's some pictures that can walk people through what some of these pathways look like, so we can start to get familiar and be able to assist clients if they have questions.
And I'll also share details later. On March 14th at South Providence Library, we're going to be hosting an event in person where residents can come and update their contact information. So stay tuned for details on that. And I'm happy to set something up similar, or anyone can reach out. I'll put my email in the chat if you'd like to set something up similar in your community. It's just sort of our first trial event for doing something like that. So hopefully that'll be successful. Kyla, any update on when flyers will be posted and available, just for folks to begin getting those out to the community for awareness?
As soon as possible. You know, to give you some context here in this space, January, we had a lot of materials ready to go. And then January 5th, the federal government changed some of the rules and some of the language. So we had to go back to the drawing board and rework a lot of that material. So we will get it out to you as soon as possible. I hope to have it out in the next couple of weeks. And we will send it through Blaze right to you. And then also share where other people will be able to find it.
All right, maybe we'll jump over to Teddy with your hand up.
Yes, thank you so much. I'm Teddy from the Refugee Dream Center. My question here is, I know it's a lot of information that is going to be out and also maybe in the media, mails and everything. I work with refugees. I know they speak so many different languages and some of these languages are not written languages. So what can you guys do to work with agencies like the Refugee Dream Center who are helping a lot of refugees around Rhode Island to read that message? I came late, maybe you guys covered that, but I just want to know.
No, I didn't get to talk about that part yet. And Teddy, know that last night on Tina Pedersen's podcast, it's called Ramp. Everybody should take a look at it. I mentioned our work so far. And this is just an example of how we are, how I am so excited to work and partner with folks. Because in this space, it's not just spreading a message, but we're educating people on cultures. We're doing so much by doing this work together that it is a treat. So what I would say in your response, Teddy, is this is where partnership is really going to work. And I've suggested that we find a way to allow people to record like in a little mini commercial some of these messages that agencies can share on their platforms. And we'll just continue to use some trusted partners to develop these messages and then share them. And then everybody can share them. And so that's what I'm hoping and looking forward to as we continue to meet people where they're at neuralistically.
Thank you, Kyla. And the other thing is going to be very, maybe sometimes difficult if agencies do not have an insider there who they can contact directly if they have any problem with the application or all that, because again, it's a lot of work and you just want to make sure like you are doing the right thing. Let's say we apply to so many people, up to 100, and then we have somebody who we can contact directly. Is that going to be possible to agencies to have maybe somebody inside?
We're hoping to make that possible through some of the mini grants. We're hoping to make that possible through our work with the health equity zone leaders and the community health workers. This is an area that we have flagged because we know that we're under-resourced in this area. So we're doing all that we can to try to make sure that we have the supports in place. So this is part of the work that we're doing right now. And I look forward to building those connections and pathways and supports as we continue going forward. So this is one of those things that we're going to just continue to talk about and make sure we get people where they need to be.
Great, thank you.
And I think that may be keeping us on time as well and makes a great segue to our next portion with Shelley, just discussing about certified application counselors and agencies. So just before we move on, addressing last couple of things in the chat about sort of putting information in waiting rooms. I do believe we will be working to have those flyers made available at healthcare facilities. Earlier, I mentioned providers. What I meant was the provider of health insurance. And just as a clarification that we had some folks tune in, that it won't be the provider offices, but rather those health insurance plans that will be able to update that contact information. So I have documented all the questions in the chat. I'll work with Kyla to make sure that gets over to the communications folks, and we can send out some more answers by a follow-up email. So with that, maybe I will turn it over to you, Shelley, and you can get us into information about Rhode Island Health Center Association and your work with certified application counselors.
Thank you so much, Blaze. And I see so many old and new friends on the call. So hello, everybody. My name is Shelley Souza. I am the program manager for the statewide Assister Network. I am at the Rhode Island Health Center Association, but our contract is with HealthSource Rhode Island. And I'm going to do a very small presentation on PowerPoint and then talk a little bit about what benefits it might be to you to become a certified application counselor and how to do so. I actually see some current certified application counselors on the line, as well as navigators that we have currently. So some of the folks on this call are already very familiar with this program. So I'm going to share my screen. So a little bit about Rhode Island Health Center Association. So Rhode Island Health Center Association has been around since 1972. That's when I was born. So I'd like to say we're growing together. We're the same age. And we have been the voice of community-based primary care health programs. We focus on Rhode Island's community health centers. So we work to support, sustain, and strengthen community health centers to provide the high-quality comprehensive care. What are community health centers? So community health centers give access to folks to provide medical, oral, behavioral health care to more than 21 million Americans. We have some health centers on this call today. I've seen a few people who represent the health centers. So just a few health centers I will mention is Providence Community Health Center, Blackstone Valley, and Thunder Mist. But I did see East Bay Community Health Center, EPCAP. I saw Tri-County on the line, and I think I saw a few more. So there are many health centers in Rhode Island. In many areas of Rhode Island, the health centers are the only source for care for those who have Medicaid or uninsured. So navigators and CACs and how we work together with HealthSource Rhode Island. So we work together to connect Rhode Islanders to enrollment support through our navigator and certified application counselor programs. So navigators and CACs are trained and certified to help connect Rhode Islanders to health insurance. We provide free, unbiased, one-to-one enrollment support to all Rhode Islanders. We help them compare options and enroll in health coverage. We help them with these obstacles that we've been talking about all morning. So with the Medicaid redetermination, with updating their information, with understanding once they have their health coverage, with understanding their health coverage. Right now, there are 15 navigator agencies across Rhode Island, including those in the community health centers. So all our Rhode Island community health centers are navigator agencies. Some of the other navigator agencies outside of the community health center is United Way of Rhode Island, Rhode Island Parent Information Network, Community Care Alliance, Amos House, Center for Southeast Asians, but you can find a full list on our website. So again, these agencies have certified navigators, and some of them have certified application counselors to provide free, unbiased assistance. There's some requirements on becoming a certified application counselor. So again, if you become a certified application counselor, you would provide accurate, unbiased information to assist consumers in making health insurance choices that are best for them. So we focus on their needs and what is going to fit their life and their health best. All CAC candidates are required to complete a full day training here at RICA. Joshua Morales is our certified application counselor trainer. So it's a one full day class. Usually it's from 9 to 4, and then successfully completing the assessment with an 80 or above to be certified. At the conclusion of the training, you will have to sign some forms that just are the conflict of interest forms and the certified application counselor affidavit. Upon successful completion of the training, the assessment, and the forms, you will be receiving a certification number and a certificate from us that is good for 1 year. So every October, you would come once a year to recertify for for the next year. And during that recertification, we'll update you on all the new choices and new things going on for open enrollment with HealthSource Rhode Island. When you work with folks as a CAC, you will display your certificate and you would sign in with the application. There's a section in that says who assisted you with the application, and that's where your information would go as the assister. And then you would have them also sign a written consent form. We do have these in different languages when you work with a customer. And then the CAC may never, under any circumstance, retain personal information on accounts. So they will be giving you things like social security numbers, date of birth, creating username and password. We don't retain anything. We always give that back to the customer for their safekeeping. And then these are some benefits. So sometimes I get questions like, well, why should I be a CAC? What's the benefits to me? So the job you're already doing in your agency, that's where you have to ask yourself, will this training help me benefit my current patients, clients, customers? How can this training help me better serve that population? Now, some of you directly work in patient healthcare in your facility and you're actively enrolling on a daily basis. I have folks that work in a health call center where they might not enroll on a daily basis, but the information that is taught in this training, they utilize it daily to help answer questions, answer calls, guide them. So this is just a few things that we've come up with that might benefit you for becoming a certified application counselor. So you have access to training and resources to better serve the customers within your agency. Become familiar with eligibility and application process for the quality health plans. Those are the commercial plans with HealthSource Rhode Island and Medicaid plans. Real-time email updates from DHS, HealthSource Rhode Island, and other resources that become available. So we get emails daily on any updates that are happening from EOHHS, DHS, HealthSource Rhode Island, lots of different things. As soon as we receive them and they're saying, this is happening, this is going on, we do a blast out to our network to say, okay, guys, heads up, this is what's going on. So we're always going to keep you in the loop on with all the moving and working parts. Assist customers with the Medicaid redetermination that's starting in April. This is a big one. This has been on hold the last few years with the recertification. So a good reason to now jump on board to become a certified application counselor is to help our customers and those clients that are going to need this starting in April. We had the Cover All Kids initiative that was passed. So maybe you work with that population of documented children, and now you can learn to be a CAC to help enroll that population. You have access to RICA's Tier 2 escalation process. Sometimes we meet folks that have been working with a patient or a customer within their agency trying to fix something, and it's been weeks, it's been months. Well, we have a Tier 2 escalation process here for our CACs and navigators that kind of go behind the scenes, and we get things fixed a little quicker. So you'll have access to those resources. And then we have other training opportunities that happen all year long, such as the MAGI Medicaid training, which will teach you a little bit more about income and how one becomes eligible for MAGI when you're sitting with customers. We had Linda Katz and Dorcas put on an immigration training, which was really helpful for those who work with that population. And then Josh and myself here put on classes throughout the year for computer application refresher training. So say you've become a CAC or a navigator and you just haven't done enough applications and you're a little fuzzy on it, you can come in and do mock applications with us on a training system, so you can kind of go through those applications without the stress of a customer being in front of you saying, I panic when they're in front of me, I get nervous. Well, you can do it as much as you can without making any mistakes because it's on a training laptop here. So we offer those for folks that just need that extra support with getting comfortable with the application. And we will be doing this from here on out throughout the year with the Medicaid unwinding. So once you become a CAC, if you want to get more comfortable with that application and you don't have to feel nervous, we're going to be offering those additional classes and supports. So that is my presentation. I will now open it up to questions. I have some agencies on here. So let me just say that navigator agencies are already in place. The contracts are already done. So if you belong to a navigator agency and you're interested in being a navigator, then that's something you can talk to your agency about. Your agency might already be a certified application counselor agency and you're not sure. Again, you can check with me. If somebody is interested in being a CAC, all you have to do is talk to your immediate managers and supervisors about filling out the application package for your agency.
And there's the application package.
I'm sorry, I couldn't hear that. What was it?
If an agency want their staff, one of their staff to be CAD, where is the application?
Well, you can go onto the RICA website. I can put that here. Just get that up. You can find the application process on our website. I will also give you my email. You can contact me directly and I will email you out a packet and any other information. Oh, I think I'm putting this directly to somebody instead of everybody. Hold on.
Thanks.
We are holding classes, certified application counselor classes, the last Wednesday of every month, starting March 29th. So if you look in your calendars, the last Wednesday of every month, there will be a class offered. If you are interested, you can email me. I will get all the information you need over to you, and then you can discuss with your agency if that's something that you would like. Let's see. What's the difference between a navigator and a CAC? Okay, so a navigator has to belong to one of the contracted agencies. There is like different contracts that they receive. Those agencies get paid to be navigator agencies. The navigator takes a 3-day training. Navigators have a different accessibility into an application. They actually have their own login where they would kind of go in and work with the customer. So it's a little bit more extensive training. They have to do reporting every month. They have to send reports in on the customers they serve and data along with that. So it's a little different. A CAC is more like an assister. So they get familiar with the process of the healthcare, familiar with Medicaid, familiar with HealthSource Rhode Island plans, and they assist a customer. There's no reporting requirements attached. You don't have to, I mean, sometimes CACs will come for training and then they don't come back for recertification. They had enough training with just that one time. So there's really no attachment or strings with it. It's more of just a benefit or a resource to you to utilize with your agency, where navigators have a little bit more to report on and a little bit more to do with their contract. And do you need to be working at a designated agency or can anyone apply? No, you have to be working for a specific agency. What we do is we will look at the agency who applies, myself and HealthSource Rhode Island, and we would decide whether or not that agency would be accepted as a certified application counselor agency. So basically individuals couldn't apply on their own.
But as you said, Shelley, individuals that are interested can certainly speak with their managers and about having the agency apply.
Absolutely. Yep. I see many agencies on here that would qualify to become CAC agencies. So if you are interested, we get individuals all the time. I've had some individuals. I'm really excited. I see the HESs on here. I've been trying to get the HESs on board for a long time to become CACs. So please, if you're from a HES, shoot me an email. I would love to get you guys on board and train to help the community.
And does anyone that's on from a CAC agency or any navigators with experience, if you want to raise your hand or share any information about just sort of your experience and maybe the process, if you feel like you're interested, as far as, you know, the benefits that maybe it has for your work, or the impact you felt.
I won't call anybody out that I
No.
see on here that are current CACs or past CACs or navigators.
No, I know it's a lot of pressure on the spot.
There are
Um,
some though. We have some current ones on here. Josh just trained Patricia. She just got on board. We were so excited that Central Falls School Department has joined the network.
I was going to say that, believe it or not, it's a great experience, wonderful training. I mean, at first it's really overwhelming because of all the information, but as the day goes by, it's really, really an amazing opportunity. And so what we're doing is our homeschool liaisons, the staff members who work with families all the time, are being trained. I was part of the first cohort a month ago. Now we're waiting and looking forward to another 5 people who would be part of the March cohort. But just knowing and having the right information to be able to communicate with our families, to know, for instance, I know with Progreso Latino and the association, you guys are in Health Source, obviously you're doing a great, a big event here in Central Falls to enroll kids. And so just that itself, I agree, Shirley. I will encourage people, if you are with an organization, to really try to take advantage of it, because you'll be surprised when you could use the information and the skills to be able to help somebody that you come in front of you for any particular service. So yeah, thank you.
Thank you, Patricia. So yes, we would love to really get our network robust for the next year of what to come. So if you are interested, many people will take the training. So we don't expect you to come and get all this information and just leave and be experts. We are here to guide you, to help you. We will have CACs or navigators that say, I'm going to be enrolling my first family this week. And I'll say what day and time, and I'll put it on my calendar. So I'm by the phone and email for that extra support for you for that first time. We're here to guide you, to help you. We want you to be successful. If you are community health workers and you're going in the home and you're just, you know, a question might come up and you just wish that you knew where to go or what to do. That's what we're here for, you know, so just think about it. And if you want to email me or give me a call afterwards to just talk it out and say, you know, I'm not sure if this would be for me, we can talk more about that.
Awesome. Thank you so much, Shelley. And I saw one other question further up in the chat about where's the best place for someone to apply for Medicaid for the first time, which I think is an important part of this process if we're going to have the knowledge and be out in the community helping people sort of redetermine their benefits. If we, you know, encounter a community member that's looking to get on Medicaid for the first time, if they're eligible. I don't know, Shelley, if you can speak to that or any other representatives.
I mean, there's so many different ways to apply for Medicaid. And when Kyla was talking about updating information and different ways to do it, one of the things that she didn't mention was CACs and navigators can do that. We can help customers update their information. in application. So utilize us too. We're happy to help. But you can, if somebody is computer savvy, you can go right on to HealthSource Rhode Island and start an application. You can call HealthSource Rhode Island. You can do the old school paper application with DHS. You can make an appointment with a CAC or navigator. You can come to one of my virtual events. If you go on to healthsourcerhodeisland.com, you'll find events. And then we host virtual events right now a few times a month, and make an appointment, and I will connect you with one of my navigators, and you can do it that way. We do have customers that will say, we started the application ourselves, and then they say they become stuck. Sometimes there's something they answered incorrectly, or maybe they just needed to do a identity clearance and they didn't know to call into HealthSource. So there's a few different ways, but there's in person, there's over the phone, there's virtual events, we have Zoom we could do. So there's quite a few different ways to apply for Medicaid.
All right, thank you. Anyone else with any other questions, either for Shelley or things that have come up as a question for maybe Kyla before we move on and close things out for today? And again, I've been copying over everything in the chat, so I will definitely review that afterwards and connect with those in need. I did put my email in the chat as well. If you scroll up a bit, you can find that. You're more than welcome to reach out about brainstorming different ideas for outreach and such. The US Census Bureau does have data available for mapping, where you can sort of get some more insights into maybe your local population and such. So I'm happy to share some information on that as well that might be useful for outreach workers, just as far as considering languages that are spoken at home, maybe where people have internet access at home and where those do not. There will be a mobile app coming down the line, so we'll be sharing that information as well for you all once that is ready to go. That might be useful for some community members to utilize. And like I said, we're working to set up a few community events where people can come in and get some information. And then Shelley as well, I know there's the Navigator tool on HealthSource. Community members can use that as well if they are looking to get connected with someone.
What do you mean the Navigator tool? I'm sorry.
I think, sorry, there's you can search for a navigator or
yes.
on a healthy road.
Oh, yes, there's that is just a like a search, like here's some navigators in your area. Anybody can use that. Yes. Yep. Those are a list of different navigators that sit by venue or by agency, by language. You can find them by language. Yep. That's a great tool on the HealthSource website. We also have navigator brochures. Blaze, I can scan some stuff and send it over to you if you want to blast them out to your network. We actually have like a navigator brochure by agency. I can also send you a current copy of the different CAC agencies and things like that.
Wonderful. And I just put in the chat the link for that, and that hopefully some of you on here that might not be registered navigators or agencies yet will maybe be on that list within the next year or something. So that's an additional tool for folks. Jennifer?
This was already mentioned. Are there any fees for the initial certification or the recertification every year?
Did she say, are there fees for CACs? No, the training is free. If I didn't mention that, I'm sorry. The training is free. The recertification is free. So no cost to the CAC or the CAC agency at all. In fact, we buy you breakfast if you come to our training.
Thank you.
Right, and just to clarify, as far as for Medicaid, for the first time, applying for that for the first time, there's the HealthSource website. Navigators can assist with that. I just saw the question in the chat again, and I can certainly send out some more information on where to access those paper applications and such as well. I think those are on DHS's website. But maybe, you know, as far as if you're tech savvy, just logging on to HealthSource. I had to do it during the pandemic. I know things might be a little easier for me than for some other people. But, you know, I turned 26 in the pandemic. I was unemployed. And so I had to get off my parents' health insurance, go through that. And, you know, I found it an easy process, but again, my situation might be different than others. But that I found as the easiest, quickest way for me to get on Medicaid when I did. So I see some other things coming in the chat here, so I will copy those over as well. And if there anyone else with other questions before we leave for the day?
Blaise, all I would ask is that anybody who's interested that didn't get a chance to get my email in the chat, if you could send it to them, please.
Definitely. I will put that in our follow-up email. I'll put your information and Kyla's information as well. And I think I'll be able to go in to Zoom and download all the attendees and make sure we get that out. I have anyone that accepted the invite. I'll have your invite on your email on there as well. So, but a big thank you. Thank you, Shelley. Thank you, Kyla, for coming together today. As a reminder, this is going to be a 3-part series. So we'll be meeting again on March 9th and then on April 6th to continue to bring you information. So if you accepted the invite, hopefully those other dates will be on your calendar. The meeting today was recorded, so we'll work to have that upline and available. And I see some questions as well about the PowerPoint slides. So we'll make sure that we get those out in a shareable manner that you all can share with other folks at your agencies, organizations, to get that information out further. So I will copy those over, but thank you everyone for joining. Have a wonderful afternoon, and I hope we will see you all again next month.
Thank you so much.
Thank
Have
you,
a good
everyone.
day.
See you next time.
Bye, thank you.
Thank you very much.